The management of the hot swollen joint. The hot swollen joint is a common presentation and has extensive differential diagnosis. Some of the most serious causes are septic arthritis, with a case fatality of 11%, and acute leukemia in children. Late diagnosis and poor treatment leads to joint damage and death. And the commonest affected joint is a big toe, typically due to gout, and can be diagnosed on clinical grounds. The patients with a short history of a hot swollen and tender joint or joints with restriction of movement should be regarded as having septic arthritis until proven otherwise. And if clinical suspicion is high, then it is imperative to treat as septic arthritis, even in the absence of fever. And the causes are septic arthritis, reactive arthritis, monoarticular presentation of polyarthritis, inflammatory arthritis, gout or crystal arthritis, hemarthrosis, trauma, bursitis or cellulitis, leukemia in children, and hemophilia. The symptoms are fever, joint swelling, as monoarthritis, joint pain, and limited mobility of affected joints. Signs that are usually elicited are hot, swollen native joints, fever, joint tenderness, investigations, FBC, ESR, blood culture, blood film comments, C-reactive protein, serum uric acid level, BE creatinine, liver function test, synovial fluid aspirate for microscopy and culture, X-ray of affected joints, MRI of the affected joint, and ultrasonography to aid diagnostic aspiration. The main treatment objectives are to reduce pain, to reduce swelling and stiffness, to prevent deformities, to delay disease progression and long-term complications. Non-pharmacological treatments, rest of affected joints, using bed rest and splints, also physiotherapy, joint aspiration. Pharmacological treatment for control of pain and inflammation. First line treatment, give diclofenac oral in adults 50 milligrams 8 hourly or 100 milligrams 12 hourly as required. In children more than 12 years, you give 50 milligrams 12 hourly as required. And less than 12 years is not recommended. Diclofenac rectal in adults, you give 100 milligrams 12 hourly as required. Then in children more than 12 years, you give 75 to 100 milligrams daily as required. Less than 12 years is not recommended. Long-term use of NSAIDs like diclofenac, naproxen, and ibuprofen, that is for more than 2 weeks, may cause renal impairment and gastritis. For the control of inflammation in the absence of infection, you give prednisolone oral, in other words 0.5 to 2 milligrams per kilogram daily, or 12 hourly with a maximum of 80 milligrams per day. In children, 0.5 milligrams per kilogram daily, or 12 hourly with a maximum of 60 milligrams per day, or intra-articular corticosteroid injection. But with this, you have to consult a specialist. For the treatment of infection in septic arthritis, we treat the infection appropriately. So referral criteria: refer patients with an acutely swollen joint to the orthopedic surgeon or rheumatologist.